Hello, I'm Jean-François Na, CEO of IHH Healthcare Malaysia. And in Malaysia, we have a few trusted brands under our network. Gleneagles Hospital, Pantai Hospital, Prince Court Medical Center, and recently, Timberland Medical Center. And my role is to drive the strategic growth and operations excellence across our 17 hospitals and strengthen our position as a leading healthcare provider in the country. And we are making very good progresses by focusing on what we do best, putting patients at the center of all that we do.
Hi, I'm Dr. Peter Chow, CEO of IHH Healthcare Singapore. This is my 24th year working in healthcare, and I've been in both public and private healthcare. And this is my 7th year with IHH Healthcare, and now I oversee the Singapore business, which comprise of brands such as Mount Elizabeth, Gleneagles, and Parkway. In Singapore, we are not just committed to growing our businesses over the next few years, but to also ensure that we achieve good health outcomes and to make our population even healthier in the coming years.
Hello, I'm Jean-François Na, CEO of IHH Healthcare Malaysia. And in Malaysia, we have a few trusted brands under our network. Gleneagles Hospital, Pantai Hospital, Prince Court Medical Center, and recently, Timberland Medical Center. And my role is to drive the strategic growth and operations excellence across our 17 hospitals and strengthen our position as a leading healthcare provider in the country. And we are making very good progresses by focusing on what we do best, putting patients at the center of all that we do.
Hi, I'm Dr. Peter Chow, CEO of IHH Healthcare Singapore. This is my 24th year working in healthcare, and I've been in both public and private healthcare. And this is my 7th year with IHH Healthcare, and now I oversee the Singapore business, which comprise of brands such as Mount Elizabeth, Gleneagles, and Parkway. In Singapore, we are not just committed to growing our businesses over the next few years, but to also ensure that we achieve good health outcomes and to make our population even healthier in the coming years.
Hi, I'm Evren Gence, Deputy CEO of Strategy and Business Development at Acıbadem Healthcare Group. I've been with the group for more than 12 years and oversee all domestic and foreign investments relating to our operations. My prior experience in capital market transactions and advisory services in leading global institutions have allowed me to play a significant role in shaping the strategic direction of Acıbadem's operations. Operating in Turkey with 18 hospitals and parts of Europe with 6 hospitals, we are committed to providing world-class patient experience where their healthcare needs are met with excellence and compassion.
Hi, I am Dr. Ashutosh Raghuvanshi, Managing Director and CEO of Fortis Healthcare. Fortis is one of the largest healthcare providers in India with 27 hospitals and more than 400 diagnostic centers. We continuously strive to deliver excellent healthcare outcomes, and that is evident through our world-class organ transplant achievements, where we are comparable to some of the best US research hospitals. Our pan-India presence sets us up for accelerated growth as we capture favorable opportunities in the private healthcare sector.
Six, five.
Hello everyone, welcome to our first Healthcare Insider series of the year and the 7th in the entire series. I'm pleased to see so many of you online. At last count, we had more than 600 people who have signed up for this webinar. So thank you very much. As you all know, our aspiration is to care for good. Today, we will place the spotlight on healthcare leadership. And what's healthcare leadership? It's about leveraging on our care expertise, our clinical expertise in areas like medical quality, clinical excellence, patient outcomes, all right? So that we can catalyze our entire healthcare ecosystem for everyone, and also to deliver sustainable growth. As a global company, how do we unlock growth, right? To ensure that our core markets and all the leaders who are here today can position ourselves as healthcare leaders in each of their markets. They've got different landscapes, they've got different issues, and different opportunities, right? So joining me today, I'm Dr. Prem Bhatnaia, by the way, Group CEO of IHH Healthcare, and together with me, I have got Jean-Francois Na, who is the CEO of IHH Healthcare Malaysia, Dr. Peter Chow, CEO of IHH Healthcare Singapore, and Dr. Ashutosh Raghuvanshi, who's the CEO of Fortis Healthcare, which is part of IHH India. So they will join me in today's webinar. Now, before I start, I would like the audience to please look at the QR code at the bottom of the screen, all right? Because there will be Mentimeter polls throughout this webinar. There will also be poll questions that you can answer. So I'll give you a little bit of time to scan the QR code and get into Mentimeter. So the first poll question is appearing on the screen. What are your expectations of a leading healthcare provider? All right, so we'll see the answers coming in. Mm-hmm. – And while we wait, maybe I will just say what the answers are, the choices that you have. What are your expectations of a leading healthcare provider? Prioritizing patient well-being and building trust. Creating a supportive and inclusive work environment. Promoting preventive care and community outreach programs. Implementing sustainable practices and reducing environmental impact. I think we can already see that many of you feel that all of the above, right, are the right answers. Among the individual answers, you can see that prioritizing patient well-being and building trust is important, and I think all of us will agree with that, right? We put the patients at the center of everything we do. But I think it's quite clear, right? I think all of you think that every single one of these 4 points are very important, right? So maybe we can move on very quickly to the next segment. And I think this part involves our ACE strategy, all right? What's our ACE strategy? Align, challenge, empower, all right? I think we've said quite a lot about these already, and you probably have read about it many times. But I think align as a group is already a given, right? All of you surely believe that aligning, right, is probably a given, and all of us, I think, feel that that should not be an issue for us at all. But challenge and empower are the two others which I feel that we can talk a little bit more about, right? And I can see that in the different markets that we are in, right, we've got challenge and empower may be slightly different, right? You may have different perceptions of it. So maybe I'll start with the question of cover the strategic priorities in your respective markets, all right? What are your strategic priorities? And how do you, as IHH leaders in your respective markets, take advantage of these opportunities, right? So maybe I'll start first with Francois. You can tell us what's happening in Malaysia, Francois.
What's happening in Malaysia? In terms of strategy, and the way we see the healthcare leadership is actually having a clear vision and also strategy that we communicated well to our organization. Actually, I believe that you will all agree we can't be successful in healthcare with short-term view. But yes, long-term commitment and commitment to our patient care, commitment to improvement, and commitment to growth and to sustainable growth. It requires also agility, adaptability, and definitely innovation. And we've seen, to be agile, we've seen it, I think almost every day. Healthcare is evolving very rapidly. Adaptability, we've seen it through the COVID pandemic. We needed to be adaptable. And innovation is about adopting totally the new technology. That is, of course, in terms of healthcare leadership, is also, of course, engaging with our stakeholder, building trust with our stakeholder. Stakeholders that are, of course, patients, that are, of course, doctor, but also the community, and definitely the payers as well. And leadership is ethical leadership as well, to uphold the highest ethical standards in what we do, in all operation at the hospital level. Of course, as you said before, a line is a given. Okay, all of this is also, of course, as a given, is financial discipline. Financial discipline in terms of budget, in terms of cost, and developing the growth of the company.
Thank you, Francois. Now, at this point, I would like to introduce the audience to one other person who has joined our webinar today, and he's Evren. Evren is Deputy CEO of Acibadem Healthcare. that runs operations in both Turkey and Europe. And Evren, I will be asking you a question later, but let me first go to Dr. Ashutosh to give your views on healthcare leadership, especially in a fast-growing market like India.
Yes. Thank you, Dr. Prem. India is a very interesting market, and there are certain levers which are operating over there. First of all, we have a rapidly aging population. Accessibility of healthcare is improving. We are seeing affordability improve. We are seeing infrastructure improve and more infrastructure being added. At the same time, the disease burden of non-communicable diseases is increasing as well. And with all that, as we have seen medical reforms in the education side, because of which the availability of clinical talent is also improving. With all these factors combining, the healthcare industry in India is poised to grow at a very double-digit kind of growth for next few years. And that gives a lot of opportunities. In these kind of market, I think the most important thing is that we have a clinically superior product. If we have good clinical governance, we focus on the outcomes and ensuring that people are aware about that, that makes us a leader.
Yeah. So Dr. Ashutosh, basically you are saying that India, very competitive market, right? But clinical excellence is the one factor that's going to distinguish Fortis from many of your other competitors.
Absolutely. That's a universal thing, but it's more so prominent in the Indian context.
Okay, thank you very much. Efren, it's your turn now. We're going to ask you, all right, because Turkey is an area that some of the members of our audience may not know so much about. So maybe you can give us an insight, all right, into Acıbadem, what you do, model of leadership, right?
Sure. Hello from a very beautiful and sunny morning in Istanbul. I think spring has arrived. I apologize for not being there, but hopefully next time. So Dr. Prem, maybe first and foremost, Turkey is a very dynamic country with 85 million population, and it's got all the right underlying factors, I think, to be a very dynamic one. But maybe if we take a step back and see what happened in 2023, I would say Turkey has come out from a very eventful 2023. We had a devastating earthquake, followed by back-to-back elections and extremely volatile macro environment, which obviously creates a lot of challenges, in every sector, including healthcare. With that being said, though, I guess the uniqueness of Acıbadem, catering to a certain A+ segment in the market, truly differentiated us from the competition, and we tried to doing so. And we have a lot of different examples in Turkey, Europe, and also as well as medical tourism is another area that I would think of. Turkey, for example, last year we invested in Izmir, which is the third largest city, which we never had any influence, any presence over there. And with that, now we're also taking the Acıbadem level of quality care wherever we can serve our patient clientele, as I mentioned. Medical tourism is another area we're focusing heavily on. We're going pure digital on that, a lot of initiatives. And maybe you and I discussed this earlier. What I would say the tagline is, we can bring in patients from wherever Turkish Airlines has a direct flight.
Yes.
So that's what I would say.
Yeah. Thank you, Everett. Now, before I go to Dr. Peter Chow, can I remind the audience, please scan the QR code. All right, if you have not already, get into Mentimeter. You can ask questions even now as we go through this webinar. So please ask your questions, and later we will ask the panel to answer some of your questions, right? So now coming to Peter. Peter, Singapore may be a little bit unique in our market because it's a very, very developed healthcare market. It's a small market, all right, but it's a very well-known for its quality healthcare. So what are the unique features of Singapore, all right, that you feel, all right, will continue, right, to help it remain as a healthcare leader in the region?
Yeah, thanks, Dr. Prem. So you are right. I think in Singapore, we have spent many years pursuing high quality healthcare, particularly building up our hospitals. But you are also right in saying that Singapore is becoming a super aged society. So interestingly, I think amongst all of IHH market, Singapore may be one of the most oldest population market that we are looking at. And I think what matters to a market like Singapore is not just high quality of care, but how we remain relevant in terms of containing costs, providing cost-effective treatment and management of health care, diseases, and achieving good outcomes, as well as how we continue to support people as they age. Now, I think you know that for most people, they do not spend most of their time in the hospitals. And as we all age, a lot of the healthcare needs actually arise from outside of the hospitals, and there will be increasing need to support the population to age well, to be healthy outside of the hospital. So this is exactly where we are heading towards. We are also looking at growth and development outside of our hospitals into the community, looking at ambulatory care centers, looking at primary care to actually support our population, to ensure that we support them as they continue to age and we remain relevant. On cost containment, for example, we are also looking at how we can move ahead of what we have been doing. I'll give an example. We have a unit that's called iExchange. This is a third-party administrator that works with insurers and employers to administer healthcare benefits. And last year onwards, we have been working very actively with insurers to look at how we can moderate and contain the cost of healthcare for them. And I think this has actually improved a lot of the results in the sense that we have actually even doubled the amount of referrals coming from insurers into our hospital business. So this is in Singapore in a nutshell is how we continue to remain relevant so that we can still be a healthcare leader.
Thank you, Peter. So maybe since you spoke about inflation, right? Singapore is seen as a high-cost healthcare delivery country, right? What are the things that Singapore is doing to moderate some of these costs?
Yeah, so you're right. I think fortunately or unfortunately, the Singapore dollar is very strong because also of the high quality of care that we are providing. And we know healthcare is not cheap, right? So on one hand, I think we are looking at how we continue to put in various innovations, contain costs, look at strict discipline to ensure good outcomes. For example, we have started over the past 2 years looking at value-driven outcomes so that we ensure that there is clear clinical pathways, discipline by the clinicians, and compliance to good established evidence-based practices to ensure the best outcomes for patients. On the other hand, we are also continuing to increase on our value proposition to patients, not just in Singapore, but regionally as well. So for example, we have invested in a proton therapy center, and this is a high-end, a new technology so that we can continue to not just ensure that our position is strong in being able to look at precision medicine and deliver high-end medicine for our patients as well.
Yep. Okay. Thank you, Peter. I think that's very, very interesting. We've got questions coming in through Mentimeter. So maybe one of the questions, what do you see as the top 3 challenges in operating a hospital group today? And I'm going to direct this to you, Francois, because I know that this is one of the issues that we face in Malaysia, right? Costs creeping up.
Yes. Healthcare costs, healthcare will continue to rise. At the same time, the demand for private healthcare is also increasing. So for us, on our strategy that we have is to continue to grow to meet the demand of patients. And actually, by growing, it helps us also to make some what we call economy of scale, building up on our what I call cluster strategy. And it's not growing for just the sake of growing. But the demand is there. Patient number increase, not only locally, but also through medical tourism. So it's important for us to stay also, as you mentioned, Peter, to stay relevant, competitive. And this is where the cost will come in, to stay competitive. And we can say sustainable. Actually, we have to grow. If we don't grow, actually, others would grow and we would become irrelevant. Even now, Dr. Prem, and maybe my colleagues here, you may not know, but 20% of the patients seeking care in the private sector are actually coming to our IHH Malaysia hospital. We are talking about 20%, which is actually
From overseas?
No. Locally, we're talking about the patient
20%
volume. It's
total volume.
20%
Wow. Okay.
are coming to IHH hospital, which is our Gleneagles, Prince Court, Pantai, and even Timberland. So in terms of cost, of course, what is important is, as you mentioned, is actually value-driven outcome, improve the quality of care, outcome, what we call the patient-defined outcome, but also what we call is actually the patient experience. We need also to improve the experience while at the same time controlling, managing cost. Not sure that we can really reduce the cost. Reduce not, but managing the cost, definitely yes.
Yeah, thank you, Francois. So I think now that we have got all our leaders here, and everyone there as well, I think one of the things that would be probably good for us to discuss would be, what do we have in store for the next 5 years, for example, right? Coming up in each of our countries. So let's shift our focus from current to the next 5 years, all right? And maybe I'll start with Ashutosh, right? Because India is one of the most vibrant markets in the world today. Many say it's the fastest growing healthcare market in the world, right? So what will be the focus for Fortis in the next 5 years?
Absolutely. I think India has got so much potential and so much requirement for more capacity to be added. So simply that is one of our objectives as well. However, as I would just take a cue from Francois about the unit economics, that is also a very, very important subject. So in Fortis network, most of the hospitals were about 300 bedded or so, or smaller. So it is important that we make the unit economics better. For that reason, most of our hospitals which had the capacity to grow, we are adding brownfield beds over there. So total of about 1,800 brownfield beds, plus one of the acquisition which we had done, which would take us to about 2,200 beds more over the next 3 to 4 years. Within next 3 years, we should be able to commission all these beds, and we will operationalize them as the occupancy figure go up. One of the challenges is to make sure that the occupancy remains high. So that is ensured because all these hospitals where we are adding these brownfield beds are currently operating at a high occupancy level of 75 plus. So we know that this is going to get absorbed very quickly. However, we are also looking at some inorganic expansion within these given clusters. There are opportunities where there are standalone hospitals which could possibly add further value to our network. So those are the other areas of expansion we are looking at. Expansion is one part, but as I was saying earlier, that the clinical leadership is the most important part. So we are focusing a lot on what kind of clinical programs we are delivering, what kind of governance framework we have, what kind of outcomes we have, and publishing our outcomes so that people at large know that what kind of quality is being provided. So that is another area of focus. And the last area of focus is to have best possible technology, both in terms of medical equipment, etc., as well as the information technology where we have provided the best possible EMR, etc. So we are in the process of implementation some of those initiatives. and that will keep us on the cutting edge.
Okay, thanks. So what Dr. Ashutosh is saying is that essentially, all right, many of the Fortis hospitals are operating at fairly high occupancy, and if you don't do anything about it, you will start losing patients, right? Because you can't get beds, you can't get specialist appointments. So very quickly you are ramping up using brownfield projects, which very quickly come on stream compared to say a greenfield or an acquisition, right? And that allows you to continue to increase your patient volume, right? So I think that's one of the key points, which I think it's also happening in many of our markets.
This is exactly what I was saying. Very close for us. We are running, most of our hospitals are running almost at full capacity as well.
Yes.
So in the context of, as I said, a continuous increasing demand, not only locally, but also from medical tourism. So for us, we have also to increase our capacity. How do we increase our capacity to unleash the available beds that we have in our hospital? Secondly, building also new medical blocks, like for us in the Klang Valley, but also in...
Bring in more consultants. Yep.
Bring not only consultants, actually we need also to have more staff. Which
course,
actually could be also one of the challenges. We're talking about what are the challenges now, but it's also, of course, on getting enough staff. But yes, building new blocks and simply also to meet the demand.
Yeah.
But beyond that, it's also about acquisition in area where we are not yet present. And our recent acquisition in Sarawak,
yep.
in Timberland Medical Center is a good example that fits very well also to our strategy. Also to be well placed for medical tourism, when we know that in Sarawak, 30% of the patient can actually be from medical tourism coming from Indonesia.
Yeah, indeed.
Yeah.
Yeah.
So that's actually part of our growth. At the same time, while increasing our capacity, we'll increase in the next 5 years between 1,000 or 1,500 beds.
Yeah.
Which is actually could be close to 50% of increase of what we have now.
Great.
And at the same time, it's actually to upgrade also, to modernize our facility, to future-proof our organization, and to be ready for the next 15, 20 years.
Yeah, so future-proof, that's the challenge, right, for all our markets as well.
Right.
And I'm glad to hear that in Malaysia. Now, we've got questions coming in through Mentimeter, but I'm going to go straight to Evren now. Evren, you spoke a little bit about Turkey earlier, all right? And I wonder if you can address, for the 5-year plan, focus a little bit on Europe, right? Because that's an area that Acibadem has been expanding to in recent times. And maybe just to give a flavor of what's happening in Europe.
Sure. Dr. Pram, when I look at the growth in Europe, first of all, as part of our business strategy, we are very keen to do portfolio diversification, which means if you look at today, almost half of Acibadem's revenues are coming from non-lira sources, which includes our European investments, as well as the medical tourism receipts that we get from the foreign patients that we serve in our hospitals within Turkey. So with that, when I look at Europe, to me, it's a twofold strategy. One is Western Europe, the other one is Eastern Europe. So take Western Europe. What happened is, if you look at until our investment, so we have 6 hospitals in Europe. One is in Holland, Amsterdam, and then the other 5 is located in the eastern part of Europe. So maybe I'll speak a little bit about West first in Amsterdam. What happens is, up until the investment in Holland, all of our investments were in emerging markets. Given the awareness of the brand, the strong reputation, it was almost a plug and play for us to go out and invest in countries like Macedonia and Bulgaria and make profits over there. But given the maturity of the ecosystem, we also wanted to test ourselves in a relatively stable market. So Holland just posed an opportunity, and then we started small. We started small at 5,000 square meter day surgery hospital, but I guess what is unique with Acıbadem, we very quickly made the difference in Holland by streamlining the patient experience, the journey itself, as well as the quality of care. With that, in a very short period of time, we doubled our capacity, and now we're looking to opening up our second facility within Holland. So what I would say, this success that we generated, we want to replicate in different parts of Western Europe where we believe that it fits our strategy as well as the different healthcare factors in investing in those markets. So that's Western Europe. That's something that we're very keen on and continue to look out for opportunities. On the Eastern Europe, so we have, as I mentioned, it's actually becoming 6 hospitals. We just acquired a new hospital in Bulgaria. So I would look at Eastern Europe as a cluster, as Francois mentioned, the cluster strategy, because of the proximity to not only to each other as well as the Turkey, we can definitely drive significant benefits out there. And as I mentioned, there are numerous things that we're looking at. We are very hopeful and again keen on growing our presence in Eastern Europe. Could be in the form, and the form can also differ from the different market dynamics. For example, in Belgrade, in Serbia, you can do a greenfield facility, whereas there are also a lot of very attractive M&A acquisition opportunities, which we believe that we can tap on in near future. So that's why what I would say in overall, we're quite excited for the next 5 years to take Acıbadem to a different level with this new expansion strategy.
Thank you, Everett. Actually, you have highlighted a point which I think is worth repeating, which is the fact that Western Europe is generally seen as a very mature healthcare market with not many opportunities for private healthcare players to go in and expand. But you have succeeded in Netherlands, first in Amsterdam and now going to Rotterdam, primarily on the back of a very strong brand name, Acıbadem, as well as your superior patient experience, right? Which is the thing that I keep hearing about the Amsterdam facility, right? Am I right?
That's right. That's exactly right. I mean, it's like I said, because of the maturity of the ecosystem, and what the market really needs, it's very easy to find out those niche areas that can differentiate yourself. And that's what happened in Amsterdam. We were very quickly ranked in the top 10 private hospitals within Holland, within the second year of operations.
Yeah, very interesting. Thank you very much, Everett. Now, on that note, talking about expansion capabilities, as compared to Malaysia and India, Singapore is generally seen as, a place that private healthcare is maxed out, right? So Peter, what are you going to do in the next 5 years?
So I think like what Dr. Ashutosh and Francois mentioned, for Malaysia, while they focus on growing the capacity, I think in Singapore, the focus is on growing the capability. You see, I mentioned that our population will get older. They will need even more intensive care. Actually, we have already seen it. Ever since COVID, many of the patients coming back to the hospitals, especially from regional countries, they are actually a lot more sicker than what we have seen before, which is why our hospitals will continue to grow in these areas in capability so that we are able to take care of some of these more sicker patients, have better technologies and grow. And the other area that I wanted to highlight is that, you see, we don't just think of healthcare as episodic care anymore in Singapore. We are now starting to think about healthcare as longitudinal care. Because you see, through our different life stage, from birth to adolescent, to even when you are middle age, especially when you're old age, you need a lot of care. And this is exactly what we are trying to grow into, because when you start to think like that, the limitations are endless, right? The possibilities are endless. We are not just looking at even brick and mortar facility anymore, even though we are actually growing out of the hospital facilities, clinics, ambulatory centers, but we are also building platforms. For example, teleconsultations. We are looking at digital platforms to be able to continue to serve our patients when they are out of hospital or even when they are not sick. How to optimize their health, how to ensure that they continue to remain healthy. And like I said, when you start thinking like that, the opportunities are quite endless.
Thanks, Peter. So I think this probably will address one of the questions that has been asked. What are your thoughts on the strategy of hospital goes to the patient instead of the other way around? One possible approach of addressing the issue of nurse and bed shortages. So the public sector already has got the mobile ward at home project, I believe, all right? Does it make sense for IHH Singapore to look at this as part of your out-of-hospital strategy?
Certainly. In fact, interestingly, next month we are actually launching our Parkway Home Care, which is a collaboration between our Parkway Rehab and our Parkway Shenton group of clinics. So certainly we are heading in that direction. Like I mentioned, we are no longer looking at healthcare as being limited by brick and mortar and physical facilities.
Yep.
But not just at home, but also in workplace. Because under our iExchange, we actually are already serving the health benefits of close to 600,000 employees, and that is 20% of Singapore's workforce. So we can do a lot more.
Very interesting. Yeah. So I think clearly Singapore's strategy has to be very different from that of our other countries. It's more or less mirroring what has happened in the United States from 20 years ago. Because of the high cost in hospitals, they've moved out to ambulatory surgical centers and then on to ambulatory centers as well, right? Yeah. Now, there's a question which I'm going to go to, and this is for Dr. Ashutosh, because probably this applies to India. Disparities in access to healthcare services based on factors like income, location, and demographics remain a significant challenge. Are we ensuring enough equitable access to quality healthcare for all populations as an ongoing priority, and how? Ashutosh, I'm asking you this because I know there's some government scheme and there are various things happening in India overall. Maybe you can elaborate on this.
Yeah, so India definitely has a situation where access to healthcare, and sometimes because of economic barriers and sometimes because of physical barriers, is a reality. And to overcome that, government has come up with several programs, and one of them is called Ayushman Bharat program, which is a Prime Minister's insurance scheme. And that is run in a trust mode or insurance mode in various states. So the problem with that scheme is that the rates which are being offered are relatively low. So that becomes a challenge for the private hospitals such as ourselves. However, there are reviews happening of the scheme. So as you might be aware that I'm immediate past president of Nat Health, which was one of the healthcare body in India. And I'm also on the committee which is looking at the review of this Ayushman Bharat program. So idea is to make sure that more participation happens from private hospitals in this program. And for that, they are trying to rationalize the pricing structure, at the same time create a situation where all other administrative hurdles are also not there. So we as an organization also are looking forward to the reforms in this scheme so that we can address at least some segment of our beds for these kind of patients who are covered under these programs. So that is one of the way we are doing. The other thing which we are doing is the technology thing, and as Peter was saying, we are also looking at the teleconsultation platform, which gives access to people in remote areas for our doctors. At least for the second consultation in oncology, we have developed a substantially large program. Similarly, we have developed a program on mental health as well, which has a huge online kind of counseling service available. So these are some of the ways we are trying to make the healthcare more accessible our patients.
Yeah, actually that's fantastic to hear. So essentially, although we are a large private healthcare provider in India, you participation in Ayushman Bharat ensures that there's some kind of public-private partnership, right? And you will do some of that. And I know Francois is doing some of that as well. You use technology, all right, so that they don't have to come all the way to our tertiary hospitals. You can do some of this in the community.
Yes.
Right. So I think these are the ways in which we can address some of these issues of access and cost. Right? Now, so very quickly on to Francois, just because I know we have taken part in the Life Renewed program.
Yeah, we do face actually the same situation. Disparity in access actually happen in quite a number of countries, but it's also our duty to build trust with patients, but not only what we say our patient, but also patient from the public sector.
Yep.
And actually, as an initiative in Malaysia, we have entered into a public-private partnership where we offer radiotherapy and radiosurgery access to cancer patients from the public sector to actually be treated in the private sector. So we actually started about 2 years ago with the first batch of 500 patients that has been now completed.
Yes.
So actually, just recently, we renewed the partnership
Yes,
with the
you were
government,
there.
with the 500 additional. So it's a good example on where we can simply do good for patients and probably to overcome, to some extent, the access.
Yeah. So in fact, I think that we are good. This is a good time to address this question, which I see here. How can you strike a balance between the human and financial aspects of healthcare while maintaining quality and patient safety as costs rise? What are the challenges and how are you addressing them? Now, so firstly, as Group CEO, I want to say there's actually no trade-off between these two. Absolutely not. Right at the start, when I said that we have got the A strategy, Align, and maybe I didn't elaborate on it, Align puts the patient at the center of everything that we do, right? And we will never trade off financial, right, results and quality, right? So things like medical quality, clinical excellence, patient outcomes are right at the top. And in all our countries, we have got medical bodies, either medical directors or we've got medical advisory boards. In the case of Fortis, they've got a very, very organized system of specialty-based medical groups, all right? So I think, and our video program, all right, our value-driven outcomes. Peter, maybe you want to talk a little bit about it?
Yeah.
What we do. And video, just to let everybody know, is value-based healthcare, right? Yeah.
So for the value-based outcomes, what we look at is some conditions which are pretty standardized and evidence-based. For example, endoscopy, knee replacements, and procedures like that. We actually track the processes that the clinicians take, and we actually track all the way to the outcomes, and even to the point where patient is discharged and how they are recovering a couple of months down the road. And with all of these things, we can actually ensure that we actually promulgate the best practices and we share across with the rest of the clinician bodies for practice improvement, and then we continue to track to ensure the outcome remains and continues to improve. And that's one example of what we do. But Dr. Prai, I wanted to also highlight this thing about, I fully agree about quality, safety, and healthcare being high touch. So one example that we have also done is we have also put in innovations, for example, like medical device interfaces. We have actually, that day when I was at one of our hospitals, I saw a little robot that was ferrying things across the corridor on behalf of the nurses. Right. So when we do such things like that, we take away some of the work from nurses. That allows them to ensure that they continue to spend quality time and with the patients, addressing some of the needs that some of the machines cannot address. And when we do certain things like, for example, the medical device interfaces, we also take away some of the potential errors that nurses may make when doing transcribing of notes, for example. So I fully agree with you that, these are not alternative options. These are things as healthcare leaders that we look at all in the same bucket, trying to address all together.
Yes, indeed. So I think it's consistently across our markets, right? That's the theme, okay? We always put healthcare ethics first, right? Clinical quality, patient outcomes, right? These are all the things that are very, very important
Service
to
level.
us. Service level, of
Service
course. Yeah,
level,
we are
of
a private
course,
healthcare group. Now, I just want to go to one more question before we carry on with the webinar. And Evren, this question is, do you think Acibadem's success in the Netherlands can be used as a template stroke benchmark to set up a presence in other parts of Europe? And I know we are looking at other parts of Europe as well, right?
Definitely. As I mentioned earlier in my in my discussion, when you look at our investment in Holland, in Amsterdam, it was mostly a specialized environment and a day surgery. All these stable markets, the healthcare sector, the healthcare trends, you have a very robust public program. Public insurance is out there, but there are definitely opportunities where you can make a difference in terms of the quality that you provide, or things that kind of like lacking in the market. Waiting times is a common issue in all healthcare sectors, but that's also where you can leverage off by. And this is part of being the seamless patient journey. When you have an MRI scan, you get your schedule appointed, in couple days instead of weeks or months. Or after that, your report comes out the day after versus, again, months. So that those are definitely areas that we will, and also being digital, using the Acıbadem infrastructure by making the difference. There are definitely opportunities which I believe that we can tap on.
Yeah. So what I'm hearing about Europe is that we need not follow the usual strategy of having large hospitals, but to meet the requirements, we may go in with focused ambulatory centers like the one in Netherlands, which is orthopedics based, short stay procedures and all that sort of things, right? So you can customize your strategy for different markets.
That's exactly right. I mean, the market will probably pose opportunities, and depending on that, we'll shape our strategy accordingly.
Yep, thank you. Okay, on that note, since we've been hearing quite a bit about technology, all right, I'd just like to move into the space of innovation, right? Today, you can't talk about healthcare without talking about innovation because there's just so many things that are going on in the innovation space, right? So I'm just going to give you all a bit of a free rein to tell us what's going on in your respective markets in the area of innovation. Peter, you want to start first?
Yeah. So I think in Singapore, we have adopted innovation, artificial intelligence in various aspects of healthcare, not just in the clinical care aspect, but for example, about 2 or 3 years ago, we already started using AI to do bill estimation to enable us to do very, very accurate patient bill counseling, right? And I think last year we started on AI in endoscopy. And I think this year, what we will be launching will be AI in CT for chest and lung, as well as mammography. But you see, one approach that we always take in Singapore, and I believe in the rest of IHH, is this: we will take a very, very disciplined approach in adopting technology. I'm sure the audience knows that the emergent technology is massive. And I think we need to be very careful as part of our responsibility as healthcare providers to be very selective, very discerning, look at cost effectiveness before we adopt everything wholesale as well. So that's where we are.
Yeah. Sorry, can I add on?
Actually, innovation goes together for us with what we call digitalization, where honestly we are lagging behind. So I think it's about time to
step it up.
Step it up, yeah. So you will see on how well aligned we are, not only aligned, but also cooperation within a different country, because also in Malaysia, we are adopting the AI for bill estimates and for patient counseling. So this one is done. AI also in radiology, to read a radiology report that can improve the quality, but also efficiency, as well in ECG reporting. Also AI is as well utilized. So beyond AI, it's also about digitalization and adopting application like My Health 360 in Malaysia to facilitate probably having also a better patient experience.
Yep.
So My Health 360 is our own app based on our also colleagues from Acibadem, Evren, that actually help and support patients to fix appointment, take appointment. They can do as well the self-check-in instead of waiting at the hospital where they spend time. So really address the waiting time, but also visualize their patient reports, all their medical reports. They can visualize also on the app and also pay the bill. Also will be included the teleconsult. So it's actually also a tool that truly will make a difference to patients in their patient experience and definitely also on waiting time.
Yep. Yeah. So actually, the next two questions here are on AI, right? And part of it has been answered. We are using AI judiciously, right, in areas that are very important to us at the moment, which is radiology, financial counseling,
Cardiology.
yeah, so we are using it. I believe in pathology as well in our laboratories. We are using it as well, all right? But maybe you can also hear from Ashutosh. India is an area with a lot of startups in the medical field.
Yes. But I think what Peter said is very important, that technology adoption and usage has to be done responsibly. And IHH has been doing that. We are doing similar initiatives in AI, in radiology, etc., in the areas where it is well established. But most other areas, we are taking judicious steps. Pathology is one area we have done. One of the innovations which we have done is on the service side, and we have taken the application of the app, of My Fortis app, a step further than just giving the reports and other things, to also addressing their service requirements during their stay in the hospital. For example, if they want a F&B service or something like that, they can just do that on their app, and that can get escalated very quickly, and at the same time, we can monitor it very well as to how the delivery is happening, and that is increasing the patient satisfaction level to a large extent. But other than that, as you said, that there are a lot of startups in India which are coming up with very, very interesting products. Like, for example, there is a product where they put some sensors in the bed and they can predict if a patient is going to fall.
Oh, yes.
So all these things eventually improve the outcomes. But it is very important for us to validate first and then adopt.
Yes. Yeah. So I think that's the key message. We don't use or adopt technology for the sake of using the technology, right? For example, the fall prevention you mentioned, I believe, is already now a system that's operating in Singapore hospital and Malaysian hospitals probably as well. But I know there are many versions that are actually coming out, sensor-based versus camera-based and all that sort of things as well. So I think that's the key message that we are hearing. But there's a question here, right, which says that subscription-based models, I mean with AI, for patients to optimize their health and ensuring a more predictable revenue stream for healthcare is increasingly taking shape. How is IHH positioned on this? Are we doing anything in this space as yet?
Not that I know of.
Maybe something for us to look at, right? Subscription-based models are not very popular in healthcare, right? Because you don't want to generate unnecessary use of healthcare, right? It has to be appropriate, right? But I'm sure some of these things will be coming up as well. So Peter, very quickly maybe, one question. What are the investments in Singapore to enhance technology, especially for the support functions, which is aging?
Yeah. So I think from 2-3 years back, we have already started to put in a lot of robotic process automation into our various functions. So that actually will definitely help our staff. Okay, but I think in the innovation and the thinking around support functions cannot just be limited to investment in technology as well, because concurrently there are also some support functions where some level of human touch, personalized touch is very, very important. So whilst we are looking at robotic processes, we are also looking, for example, alternative providers, for example, our call centers, how we can actually also offshore some of our call centers so that they can actually also support our customers 24/7 and even with a better service at the same time. So these are some of the things that we are actually doing. And I think going forward, what we are actually going to invest and look at more would be even from the process of how patients are coming in to our facilities, how they are registering, because that also takes up quite a lot of support resources as well. So by innovating some of this and by disrupting some of this, looking at, for example, registration on a virtual basis, that actually takes away the need for even having support staff to be physically present and working to support patients because they can self-help. And we know that that is one of the options that we want to give them in a very, very near future.
Yeah, indeed. In fact, I think maybe we can very quickly pivot to the question of manpower, all right? Because there are questions on manpower shortage of healthcare professionals, and by this I presume doctors, nurses, allied health, right? And we have, at IHH, we have dealt quite effectively with this issue, all right? Let's take nurses. WHO says that there are 9 to 10 million, we are short of 9 to 10 million nurses worldwide. We know that, we can feel it in our hospitals. Likewise, doctors, because of regulatory constraints in registration and various things. But interestingly, last year, 2023, IHH countries were actually quite well resourced in nursing, that much I know, all right? And a number of steps were taken to address this nursing shortage. So maybe, Francois, you want to give us an idea of some of the things that's happening in Malaysia?
Couple of things actually to address it. So the shortage is one thing, but also if we want to expand, of course we need to recruit more as well. So what we've done is actually to increase the sponsorship also for the nurses to take up the studies, and even to pay actually whether the bond or the total studies fee. Of course, we upgraded also simply the salary. Salary and all the allowances of our nurses to retain them and actually to basically to keep them with us instead of maybe going to even different countries. So upgrading them, recruiting more, but also getting some nurses from abroad. So we can, and we are now in the process of recruiting also nurses from Sri Lanka, also from India that can come to us.
Okay.
But actually, it's really stabilized now. We've seen also, and actually what we are doing for them, interestingly, I was visiting recently a totally new ward that we are building in one of our hospitals. And actually, it's also a way to actually improve the environment in which our nurses are working. And I'm quite sure that when they will see actually the result, they will see that indeed what we're going to offer them is actually a much better environment also to work. So our upgrading of the facility is not only for patients, but also for doctors and for our staff.
Yeah, yeah. Now, Ashutosh, I just want to come to India because I know turnover rates generally, right, in almost any hospital in India tends to be very high. India also produces a lot of nurses, right? So what are the dynamics of the nursing market in India?
I think there's an opportunity within that for the group. One is because Indian nurses have been going all over the world, so
in fact, we have them in Singapore.
Having a good presence
we're gonna
in
get some,
India,
maybe.
We can sort of formulate a group kind of strategy, and we are trying to work on that. Other than that, if we just look at the local context, nursing attrition is relatively high, but we do produce large number of nurses. And about 3 years back, we have started about 195 nursing colleges by the government of India, which means that there is large number of nurses which are going to be produced. So we would probably see some attrition happening because opportunities abroad are much more lucrative for the nurses. but at the same time, the supply side will be better. But we have also taken some measures. One of them is career progression for nurses. We are lobbying and encouraging for the nurses to become nurse practitioners, for instance. We are also sending them for higher courses, both on the management side as well as the many of them who want to specialize in different types of nursing courses, like critical care nurses or an oncology nurse or a psychiatric nurse. So we are encouraging all those things as well. But nursing is a phenomena which is across the world, I think. And I think with aging populations, this is going to remain so. So that is why it is also very important for some of the initiatives where, as Francois was mentioning, that the robot has taken over some of the task of a nurse. I think shifting of tasks, task shifting from the nurses, and anything which doesn't require a specifically qualified nurse, if those tasks can be moved out from the nurse's work, that can improve the situation and the number of nurses we require.
Yeah, indeed. So very interesting. We did a project in Singapore, I think a few years ago, to delineate the work of nurses, and we discovered that 50% of the work that a nurse does is not actually nursing work.
Absolutely.
It's administrative work, it's bathing, it's feeding, it's taking samples to the lab and all that sort of things. We did a project, and I think we cut down work completely, right? And moved them to healthcare assistants.
Yeah, we call it patient care
Patient care
assistant.
assistants, or associates, right? Yeah, and we elevated the position of the healthcare assistant to patient care associates, and I believe we brought in quite a number.
Yes.
Think about Malaysia, I'm sure it's in India as well.
Yes.
But there's something else that Singapore spent a lot of time on the mental well-being of nurses, because post-COVID, I think there was a lot of, there was abuse, there was nurses feeling very stressed out and all that kind of things. And you worked with some providers to.
Yeah, so I think over COVID, and actually even with or without COVID, the work of healthcare is very demanding on nurses. So we're very cognizant of the care for nurses. I think you're right that we use the opportunities after COVID to look at, for example, engagement with even our in-house psychologists to share with our nurses how to cope, especially that was the period where some of them, they couldn't even go back to their home countries yet. We collaborated with a company called Intellect, and we actually roll out not just for our nurses, but the rest of our healthcare providers as well, so that they have a support system, and it's a very interesting platform where it actually also delivers very, very customized mental health interventions to our staff as well, right? And I think on top of that, we also take care of other physical needs. For example, some of our nurses who were spending long periods of time commuting between the borders, right? And I think Dr. Prem was actually initiated that. We actually started providing bus services to help them so that they can actually come to work with a shorter time. They have more time to rest at home. And I think we have also restructured some of our working hours, our rosters, so that they get more time to rest. So I think this is a very comprehensive approach, not just technology, because yes, indeed, we have also done replacement of nursing workforce tasks, but we are also looking. We are also looking at the well-being of our nurses across as a whole.
Indeed. So I feel that as a group, we have been managing our manpower issues quite well. Manpower will always figure as one of the most important things that any of our CEOs, any of our countries, hospital heads will have to deal with, right? It's a given, right? Okay. And I've previously been quoted as saying that one of the things that keep us all up at night, keep us awake, it will be the manpower situation, right? A shortage. And if you're short of nurses, means you have to close some beds as well, right? But we are very well resourced now, and I think we've dealt with the issue quite well. Now, we've actually exceeded our time, but I'll take one more question before we go to a poll. And I think this is a very interesting question because it's medical tourism, all right? How do different countries complement each other instead of competing the same markets? And for this, I'm going to very quickly ask Peter and Francois, because we've got common patients coming from common countries. And then I'm also going to go to Evren, because medical tourism is very big for Turkey as well. Right?
So I will start by saying it's certainly not the same patient.
Yeah.
And why am I saying that? They are patients coming from the same country. And indeed, the market in Indonesia is almost, and I repeat that quite often, it's almost endless. But what I believe is a patient that is actually making a choice of Singapore, that can afford Singapore, the primary reason is not only price, it's because they trust the hospital there, they are confident, they know the doctor over there, and I don't believe that just for a matter of cost, they would decide the same patient, if we talk about the same patient, just to seek care in Malaysia. So for me, the way I see it, it's actually different segment of population that can afford healthcare in Singapore,
Yes.
and another segment that can afford the care in Malaysia. And of course, the patient from Indonesia that would seek care in Malaysia will definitely not go to Singapore, and the one in Singapore probably only a minority that will really be very concerned about the cost.
Yes.
That will be my view.
I fully agree with that. I think that's my view as well.
So
Peter?
perhaps adding to what Francois mentioned, right? Actually, we are also leveraging on our advantage as a network to be able to reach out to patients and not competing each other. I'll give you an example. Even in our Indonesian offices, right? Actually, we are actually using the same offices
office.
to work with patients, to assist the same patients, to help them make a decision where they would like to go, whether is it to Gleneagles KL or is it to Gleneagles in Singapore. So I think we are leveraging on the same resource to reach out to our markets, and that's very powerful. The other thing that we do to leverage on as a network and a system is we are actually referring patients to each other. So for example, Francois hospitals are actually referring patients, say for example, if they need proton therapy, right? They are actually referring them to Singapore to seek treatment because Singapore has some of these that Malaysia doesn't have. And I think the reverse can be true. So I think we are actually working very closely as a group instead of competing each other.
Yep. In fact, likewise, liver transplants now from Singapore and Malaysia actually going to India.
Yes.
Right? Because you, in India, you do liver transplants with same success rate as in the top institutions in the world at probably a fraction of the price that's, that is done in our other countries as well, right?
Yes.
Yep.
But I think the correct point which Francois made is that medical tourism patient for different market is different. It's a different segment. So I think that will remain. The patients which go to India are totally different than the ones which come to Singapore.
Now I'm going to go very quickly to Evren because earlier he mentioned that anywhere that Turkish Airlines flies to, all right, that's where your foreign patients come from, right? So Evren, in 2 minutes, can you quickly summarize the medical tourism situation in Acibadem?
Sure. What we do, I think it's a very integral part of our strategy when it comes to medical tourism. And we do all these activities within a branded name called Acibadem Health Point. What we do, it's an end-to-end journey. We have rep offices in different cities. Actually, we have 58 points in 32 different countries and 54 cities. Basically, start from the very initial consultation, take all the way for their treatment within Turkey. To me, I think the patients are more cognizant. They are smarter now. They do their research. So accessibility is very important when it comes to taking service as part of medical travelers. And what we do, we again, Acibadem differentiates itself by being center of excellence within Turkey by taking patients from many different areas, but more complex treatments like organ transplants, cancer treatments within our hospitals. And I think this is free to say, if you look at the share of the volume in our network in terms of serving the patients, medical tourists represent 5% of our volume, overall volume, but represents a much higher share in terms of revenues. That's that. And also one other thing to comment, I think with the awareness, the competition within the IHH network is very less. I can even give an example, us referring a patient from Middle East to Fortis hospitals for their needs. So I guess there is also very good synergy and communication within the country teams, which kind of avoids any terms of competition in that regard.
Indeed. So I think what's really good about our IHH network is simply the fact that we are in so many countries, all right, that serve medical tourists or medical travelers, all right, in different ways, all right, and complement each other very often as well, all right, without really sort of cannibalizing each other's business. Now, I think we are coming to the end of the webinar, and we have got one more poll. So please, audience, stand by for the questions that will be coming up. All right. This question is, which aspect of healthcare leadership do you believe has the greatest impact on the overall quality of care delivered to patients? First one is vision and strategy development. Second is team building and empowerment. Third is fostering a culture of safety. And the final one is quality of financial management and resource allocation. All right. So this one does not have all of the above. So we force you into making a decision. So you can see vision and strategy development is currently at the top. Can I encourage the audience to please submit your answers so that we can have a good representation of your views? Okay, I think clearly vision and strategy development is what many of you think is what healthcare leadership is all about. All right. I mean, it's a close fight between the others: team building, fostering a culture of safety, which for the physicians among us, I think we would say that probably ranks very high. All right. But indeed, quality, financial management, resource allocation. All right. I think as a group that is in 10 countries, resource allocation is obviously going to be a very important point as well. All right. But again, I think the audience is telling us vision strategy development.
That's probably because indeed we can't see healthcare, and when we run hospital, it's impossible for us to be successful if we go just short term.
Yeah.
So it's important to actually to have this vision on the long run in our commitment whether to patient, commitment to staff as well.
And I think it's probably because the question that was asked about healthcare leadership, and if they expect leaders to be doing vision and strategy development, of course they expect many other people down the line, all right, our chief nurses to be making sure that the nursing is of high standard, our quality team to make sure that our patient outcomes are very good, right? So I think we have come to the end of the webinar. First of all, I would like to thank the audience and all of you out there who participated. All right, it was a fantastic response. We had many, many more questions that we could not answer. All right, but we would be very happy to take some of these into our next few healthcare insiders. I think you will. This is the first this year. I think we've got a few more on other topics like sustainability and clinical quality as well. All right, so sort of stand by for more seminars, ask us more questions. Of course, I would like to thank the panel, all right, online from Istanbul, Evren, Deputy CEO Acibadem. Thank you, Evren. All right, and in Singapore in our studio, we have got Francois, CEO IHH Malaysia, Peter, IHH Singapore, and Dr. Ashutosh from Fortis in India, part of IHH India. So thank you very much. Thank you to the support team, and see you all on another occasion. Thank you very much.